When it comes to someone's health, the type of food they eat matters. When they are dealing with specific medical issues, that struggle can be even more difficult. And that's what led Samaritan House to partner up with the Second Harvest Food Bank to open the first food pharmacy in the state of California.
Ahora su fruta.
Sí, fruta y verdura.
The room is not very big, but it is just big enough to help the people who come here make some life-saving changes.
I'm trying to eat healthier than before because I used to have bad eating habits.
Welcome to the Food Pharmacy at the Samaritan House free healthcare clinic in Redwood City.
The results really are startlingly good. They're better than we ever expected. And these are, in fact, here at Samaritan House, the first 2 food pharmacies in the state of California. So we were pioneering it here.
Dr. Jason Wong is the medical director at Samaritan House.
So we are a primary and specialty clinic for patients who are uninsured and low income who live around the Redwood City area, specifically in the Sequoia Healthcare District.
Every month, 400 adult patients come through these doors. About 24 physicians and 5 or 6 dentists volunteer their time. Medicine is provided for free. But doctors had another problem.
And sometimes it's a decision between, well, do I buy healthy food, or do I pay the rent, or do I pay the electricity bill?
So in January of 2016, the food pharmacy, modeled after one on the East Coast, opened its doors. Doctors started writing prescriptions for food.
Mark off that they have diabetes or hypertension or hyperlipidemia.
Food from the Second Harvest Food Bank, specifically chosen to meet the needs of patients, is set up right down the hall from exam rooms.
So we have canned salmon, we have canned tuna, cereals for children, low sugar cereals for the children as well, more protein items.
And Alex Navarro, the nutrition educator, sits all the patients down for a talk.
They come to me and I'm really educating them on how to read a food label for the first time. I'm talking to them about whole grains, the importance of choosing the right types of fruits into their diet.
She not only introduces people to things like quinoa, she also teaches them how to cook it.
With the dish, they try it, they like it, they come back here, the food's already there. So we've provided that access.
Do you tell them that if they cook with whatever they have found in here, they're usually in good shape?
Yes, and that's the great thing about it.
Jorge Ruiz was diagnosed with diabetes 8 years ago.
At the beginning, it's really hard because, you know, I didn't have healthy eating habits.
He now makes weekly trips to the pharmacy. He gets 3 or 4 days worth of food, not just for him, but also for his family.
I'm trying to establish healthy eating habits at home because I have a 6-year-old daughter, and she's a high risk of becoming a diabetic, right?
Alicia and Rolando Bourbon both have diabetes.
You want apple?
Yeah, we need apple.
Okay.
They say the food and the help has made them feel better.
With that kind of food you serve here, it's really good to our health. Make us strong, and I think we'll last long.
It's a change Navarro says she's getting used to seeing.
I see it on their faces. I see how happy they are and empowered they are to come in here and try out new recipes.
And the idea is growing, with other clinics partnering with Samaritan House. The nonprofit is hoping to raise funding for a clinical study, but even without that study, Dr. Wong doesn't hesitate when asked if the program is working.
Actually, it's been better than I had anticipated. We're seeing preliminary outcomes in terms of their diabetes control being much better than I had anticipated. It's almost now at a level that's comparable to taking a medication.
Food, he says, is medicine.